Women can't get infections if they're healthy. Sexual health problems only happen to promiscuous people. You shouldn't discuss intimate health issues with your doctor. Annual checkups are just a waste of time. And my personal favorite, women don't need to understand their own bodies because that's what doctors are for. These dangerous myths aren't just wrong, they're preventing countless women from getting the healthcare they deserve. And today, we're going to change that.
Welcome to Digiverse Podcast. I'm your host, Mike Thompson, and today's episode, Sexual Health Matters, features Dr. Rachel Carter, a leading women's health specialist with over a decade of experience in reproductive and sexual health. Dr. Rachel, those myths you shared are quite concerning.
But they absolutely are, Mike. And what's even more concerning is how these myths prevent women from seeking proper health care and understanding their own bodies. Today, we're going to have an open, honest discussion about women's sexual health. No shame, no judgment, just facts.
That sounds exactly what our listeners need. Let's start with something you mentioned. Why are regular checkups so important?
This is crucial, Mike. Many women skip their annual checkups because they feel fine or they're embarrassed. But here's the reality. Many sexual health issues don't show obvious symptoms until they're advanced. Regular screenings can catch potential problems early when they're most treatable.
What specific things should women be getting checked regularly?
Let's break this down by age groups. For young women in their 20s and 30s, we recommend annual pelvic exams, regular STI screenings if sexually active, Pap smears every 3 to 5 years, depending on history, and breast health awareness. But here's what many don't realize. These visits aren't just about physical examinations. They're opportunities to discuss changes in your body, relationships, and sexual health concerns with a professional.
Speaking of changes, let's address something many women feel uncomfortable discussing: vaginal health. What should women know?
This is exactly the kind of topic that shouldn't be taboo. Every woman should understand what's normal for their body and what isn't. The most important thing to know is that bodies vary. What's normal for one person might not be normal for another.
Could you elaborate on that?
Of course. Let's talk about common concerns women have. Discharge variations throughout the menstrual cycle are normal. Slight odor changes are natural. Discomfort or irritation usually has simple solutions. Regular hygiene is important, but over-cleaning can be harmful. The key is knowing when changes warrant medical attention.
What are some clear signs that women should seek medical attention?
Great question. Let's make this very clear for our listeners. Unusual discharge with strong odor, persistent itching or burning, pain during intercourse, irregular bleeding, any unusual growths or sores. These symptoms don't always indicate serious problems, but they should be evaluated by a healthcare provider.
Let's talk about something that affects many women: urinary tract health. There seems to be a lot of confusion about prevention and treatment.
Oh, this is a topic filled with myths. Let me share some evidence-based facts. Cranberry juice isn't a treatment, though it might help with prevention. Wiping front to back isn't just old advice, it's crucial. Urinating after sexual activity really does help prevent UTIs. Staying hydrated is more important than most people realize.
What about sexual activity and health? There are so many misconceptions there.
This is where education is absolutely crucial. Let's address some key points. Safe sex practices are important at any age. STI testing should be regular for sexually active individuals. Communication with partners about health is essential. Protection is important, even in monogamous relationships. Birth control options and considerations. STI prevention and testing. Building healthy relationships. Body awareness and self-examination. Mental health aspects of sexual health. Hormone health and balance. Age-related changes in care, pregnancy prevention and planning, common infections and treatments, lifestyle factors affecting sexual health, exercise and sexual health, nutrition's role in reproductive health, stress management, sleep's impact on hormonal balance, environmental factors, medications and sexual health, alternative therapies, healthcare access and resources.
Dr. Rachel, this has been incredibly informative. Any final thoughts for our listeners?
Yes, Mike. The most important message I want to leave with our listeners is this: your sexual health is an essential part of your overall well-being. Don't let embarrassment or myths prevent you from seeking care or asking questions. Knowledge is power, and understanding your body is the first step to maintaining good health.
Thank you, Dr. Rachel, for this candid and informative discussion. And thank you, listeners, for joining us for this episode of Digiverse Podcast. Remember to subscribe for more episodes where we tackle important health topics with expert guests. Until next time, stay informed and take care of yourself.